What is the current process? Like, how has it evolved? Where are we at today? What did you do to address these challenges?
So what we started with first was really just being able to separate them into categories. So the upload is still somewhat manual because we need the systems that we're uploading to and from, so in our case, OnBase and Epic, to be able to do that in an automated fashion. We're working toward that, and we're working into that phase now. But again, starting with where are we really trying to go and how can we get up and moving, was to begin with, let's just take the segmentation part out. So let's have it read who that patient is. What kind of document is this? So if we know those two things, then the machine learning can put it into the appropriate proposed location. Then we still have a person going in and doing the quality review and saying, yep, that is an imaging document for this patient that needs to go here, or that is an H&P that needs to go here. But through that process, of course, the machine is learning. And so as we identify an H&P that's not appropriately in the right bucket, then the system is learning. Oh, we see this kind of variation and we need to cue that. So that's where we've been for the first several months, which honestly for our HIM team, even just having the initial buckets, because the majority of the intellectual energy that was necessary in order to do this work is that tedious part of identifying the patient, identifying the document. If all you have to do is review it and verify, yeah, absolutely, then that becomes a much less mentally taxing requirement. And so that's, again, kind of where we are now, moving into phase 2 so that we can do the upload part in a more automated fashion, with the ultimate goal, from my perspective, that we would eventually have nobody touching these.